We need to act it today. We cannot wait for tomorrow.
Nobody can do this alone. Early action saves lives. Empowering our women is also a way forward.
Zero dose children should be a priority.
If we work together across boundaries, we know we could eliminate this cancer.
Getting zero is very possible.
Hello, I'm Dr. Nginache Nampota-Nkomba, and I'm a physician earning a PhD in epidemiology with a focus on vaccinology at the University of Maryland, Baltimore. I am also the Sabin Rising Star awardee of 2021 and the guest host for this episode of Getting to Zero, where we interview global public health experts on what it will take to end preventable deaths with vaccines. Today, I am speaking with Dr. Shabir Madhi, a South African physician and Dean of the Faculty of Health Sciences and Professor of Vaccinology at the University of the Witwatersrand in Johannesburg, South Africa. He received the Albert B. Sabin Gold Medal in 2024 for his work on the epidemiology and clinical development of life-saving vaccines against pneumonia and diarrheal diseases, and he has authored more than 650 scientific publications. He is also a leading advocate for development of vaccinology in Africa. He is co-founder and co-director of the African Leadership Initiative for Vaccinology Expertise, known as ALIVE, and director of the VITS Vaccines and Infectious Diseases Analytical Research Unit, VIDA. Dr. Madhi, welcome. It is so nice to have you here.
Hey, Nginache, it's a pleasure, and thank you for the invite.
So let's start by setting the scene. How are vaccines generally perceived across Africa today? Are they considered essential to public health and development, or is there hesitancy or mistrust in some settings?
Nginache, I think the success of vaccines on the African continent really speaks for itself, and that is what has really stimulated confidence around vaccines. And for me, unlike the challenges that it face in many high-income countries, when it comes to vaccine hesitancy, we don't necessarily face the same challenges on the African continent. We've got low vaccine coverage, but that's for different reasons. It's not because of vaccine hesitancy. When you see what has happened just over the past 2 decades on childhood mortality on the African continent, where there's been more than a halving of childhood mortality rates, roughly about 50% of those deaths that have been prevented, deaths that have been prevented because of increased coverage with vaccines. Some of those vaccines have been developed way back in the 1960s and 1970s, but also the introduction of new vaccines. So we've seen precipitous decline in the number of children, as an example, that die from measles or from pneumococcal disease or rotavirus illness. And all of that is largely attributed to the success of vaccines. So the experience of vaccines and the impact that it has had in the communities is very much of a lived experience to some extent on the African continent, in that parents, community leaders have over a very short period of time been able to appreciate the reduction in deaths from these vaccine-preventable diseases. So like I said, on the African continent, unfortunately, we still experience challenges when it comes to optimizing vaccine coverage. But where vaccines are available, I think we very much of a success story over the past decade or so when it comes to confidence around vaccines and its uptake.
That gives us a very useful snapshot of how people are thinking and feeling about vaccines. But beyond perception, there are often real challenges. So what do you see as some of the key barriers to vaccine access and uptake in the region, and how can these be addressed?
Yeah. So I think there's multiple challenges, and the reasons for what has been a stagnation of vaccine coverage on the African continent for the past decade at least speaks to the multiplicity of challenges. Now, for me, I think one of the biggest issues that we face on the African continent, where many of the countries are low-income countries and are dependent on external sources for the procurement of vaccines, as well as the actual structure of the immunization program, is this dependency. And as an example, Gavi has done a wonderful job in terms of ensuring access to vaccines, including new vaccines. But there is a dependency, and it's necessary for us to be able to sort of make that leap. It requires African governments to take greater ownership of the immunization programs, from the point of ensuring that the structures are in place, that the immunization facilities are integrated into primary health care centers, which are owned by government, where government takes on that responsibility for its sort of management. But in addition to that, governments need to become much more involved in actual procurement of vaccine. So it is, we do recognize that there are resource constraints across many African countries, and there's a need for prioritization. But at the end of the day, when you're investing $1 in a vaccine, the return to the economy is up to $20. So from a financial perspective, it's a no-brainer that governments need to invest in ensuring a healthy population, which leads to healthy children and which leads to productive individuals later in life. It's sort of a no-brainer. So for me, one of the big issues is government needs to take on greater responsibility. And it's only when government starts putting its own money into the pot that they would assume greater ownership and responsibility. But in addition to that, obviously on the African continent, unfortunately, in many countries, there are a number of other factors, including issues around access, where clinics might not be accessible, where there might be stockouts of vaccines at facilities. And to some extent, that does diminish the confidence of parents around vaccines. So imagine being a mother of a 6-week-old child with 3 other children at home, and you need to take the child to the clinic, and the clinic tells you they run out of vaccines. Clearly is not going to inspire confidence. So I think, again, it speaks to ownership of those immunization programs. Then we face additional challenges in relation to civil unrest in countries, large sort of movements of populations, some of whom are refugees, and they sort of clustered in different sort in other countries. And within those countries, there might not be a strategic approach in terms of ensuring, as an example, that refugees or individuals that are affected by civil strife also have access to healthcare facilities, at least basic healthcare facilities. And again, vaccines form an important component of it. So again, it's multifactorial, difficult to pin down exactly one specific issue that needs to be dealt with. But I think to a large extent, and again, it differs by country. So it's not to say that the same challenges are experienced by the same country. Africa is very heterogeneous in terms of its composition, in terms of its health infrastructure, in terms of the extent to which governments are involved in these programs. But the bottom line for me is that we need the population, we need the mothers, the fathers to have confidence in vaccines. I think that confidence exists. And then it becomes an issue of how we make these vaccines available. And that speaks to access, and then access speaks to having a robust procurement system as well as a proper primary health care system where children can be vaccinated.
Wow, that gives great insights into, the challenges that Africa is facing. You spoke on African governments. Do you think that, in general, African governments are looking at vaccines as economically important and not just as a health intervention? And do you think they are encouraging and supporting local research and training in vaccinology?
Yep. So I think that's a really important point. Like I said, the estimate is that for every $1 that you invest in vaccines, the return on it over a lifetime is closer to $20. So there's a massive return. I don't think that's something which governments necessarily appreciate. Unfortunately, when it comes to politicians, they've got a very short-term view of life because they might have a 5-year term in office and they're wanting to achieve things over that 5-year period and they're wanting a return. It is those governments that have got a long-term vision as to how they're wanting the societies to develop that probably pay more attention to what the economic benefit is in investing what is one of the most cost-effective interventions that's available to improve health. So I think more work needs to be done, including from the scientific community, in terms of engaging with our politicians. And it's something which we probably don't do very well as scientists, including on the African continent, engaging with politicians, not just trying to get them to include new vaccines immunization program, but get them to understand what are the benefits, both from a public health perspective, but also at the end of the day, to the economy of the country. So much work needs to be done in terms of engagement, not just of politicians, but also of society. Society plays a very important role, again, when it comes to advocacy. And often, because scientists haven't engaged with society, with community members, they don't become the voice that's required to ensure that government pays due attention to ensure that life-saving vaccines are made available and are accessible as quickly as possible.
Yeah, so do you think, though, that the governments are generally encouraging or supporting local research and training in vaccinology currently?
Yeah, so unfortunately, I think at this stage, certainly not enough. If I use South Africa as an example, South Africa only spends about 0.6% of its GDP on research, where it's meant to be spending roughly about 1.5%. And for many other African countries, the amount that government actually invests in research generally, not just for vaccines, is even less than 0.6%. And it again speaks to an issue is that I don't think governments truly understand what the benefits is for research and development to take place locally, which provides security when faced with challenges such as we had faced during the COVID pandemic. So certainly what we're seeing is that in East Africa and West Africa, Southern Africa, there's pockets of excellence that are beginning to evolve, but that is largely led by academic institutions than being owned by government. So I think government needs to become much more conscious in terms of supporting academic institutions when it comes to research and development, but also when it comes to research more generally. So I don't think it's something which governments need to own, but government needs to create an enabling environment, which includes being able to provide funds for researchers to do what they're really passionate about. And that is to, again, for us, people like you and myself, look at developing vaccines and how we deploy vaccines, which are very much context specific. So much more needs to be done on the part of governments.
Yeah, that's very true. But luckily, over the years, there have been some advancements in vaccinology on the continent. In your opinion, how would you describe the evolution of vaccinology on the continent over the past 20 to 30 years, especially in terms of research, infrastructure, vaccine innovation, and public health implementation?
Yeah, I think what has transpired over the past 2 decades has been phenomenal. The type of research capacity that's been developed across the African continent, be it because of individuals that have been working on malaria or HIV vaccines or TB vaccines or pneumococcus or rotavirus, just to name a few. Even Ebola is an example. So there's been an exponential explosion. There's been an explosion of researchers in the field of vaccinology. I've been in the space now since 1997, just under 30 years. And certainly when I started my career in vaccinology in 1997, there were very few other people across the African continent that I could truly engage with. And now I probably don't know more than 10% of the researchers that have really made a mark on the African continent when it comes to research in the field of vaccinology. So there's been an explosion. And that is largely being led because of collaborations with Northern Hemisphere institutions. But what is really comforting is that more recently, we have seen much of the ownership of the research agenda being championed by people from the African continent rather than being led by the North. And I think that's important because if you're wanting to go to the next step, it's really for African scientists to set there's a need for African scientists to set the research agenda, to own the research agenda, so that we can ensure that the research that we're doing is relevant to our own context, and it addresses the priorities within our own context. So over the past 15 years, and certainly even more so after the COVID-19 pandemic and during the course of the COVID-19 pandemic, we've really seen African researchers sort of take leadership roles in the research that's being done in the field of vaccinology on the African continent, which for me, it's really extremely promising in terms of the future outlook. There obviously are still major gaps, and perhaps the biggest gap that we face at this point still, where there's sort of efforts to redress comes to the space of basic science research and the ability to actually do what is required to produce vaccines locally. And I'm not talking of just filling vaccines locally, but to do the full research and development as well as vaccine manufacture, locally on the African continent. But again, there are sproutings, there are seedlings that have been sowed, and I think we're beginning to see emergence of that, not just in South Africa, importantly, across many countries, Rwanda, Kenya, Senegal. We've got a number of countries where there's much more sort of activity taking place, even in the field of vaccine manufacture, which forms an important component of research in the space of vaccinology.
Like one of the most defining moments for the field globally was the COVID-19 pandemic, as you already mentioned. And I know you played a key role in South Africa's COVID-19 vaccine trials. What did those experiences teach us, both scientifically and politically, about Africa's capacity for vaccine development and deployment during a crisis?
So the work which my research unit contributed to around COVID-19, the only reason we were able to sort of play a reasonably important role in that space was because of the work that we had done in the preceding 23, 24 years, where we've largely been focused on vaccines against respiratory diseases. And we have developed networks, we developed expertise to be able to conduct type of studies which we undertook. So there's sort of a background that led up to that. And not just my own research unit. When you see many of the other individuals on the African continent that contributed to research around COVID-19 vaccines, many of them have been in existence for 10, 20 years. Some of them were more involved in HIV, but they pivoted their research and they basically started to focus on COVID-19. So it really speaks to the ability, the need to develop the expertise locally, which when faced by the crisis, you can use that expertise to address the crisis. And I think that's the reason why we were largely successful in doing what we were able to do. Now, what we weren't able to do during COVID-19 is obviously we weren't able to develop our own vaccines. We were very much dependent on the outside world for us to do the type of clinical trials which we did in the African continent. And I have to say, the type of results that we generated with those vaccine trials were the first of its kind in the world. As an example, we were the first to show that these vaccines that were based on an index virus, that they weren't that effective against the variants that were beginning to evolve, but at the same time, they could still protect against severe disease. And the first evidence for that came from our studies in South Africa with the AstraZeneca vaccine as well as the Novavax vaccine. So had we not done the studies in South Africa, the world would have been delayed in terms of the understanding of the importance to update COVID-19 vaccines to be more relevant to the variants that were circulating at different points in time. So we were very much the leaders in that space. So in addition to that, the type of work that we did also was important in terms of informing how these vaccines work in populations that are disproportionately represented on the African continent. As an example, unfortunately, even to this day, we've got a reasonably high percentage of the population in South Africa that live with HIV. And the data that were generated from our studies were the first globally to see how these vaccines performed in people living with HIV, as an example. So I think we played an important role in the broader landscape of vaccines around of research around COVID-19 vaccines, and we certainly made a mark. But again, where the African continent fell short is many countries weren't able to do studies on COVID-19 vaccines, weren't able to do the type of research that was required, simply because they didn't have access to these vaccines. Fortunately, for my own research unit, I was able to sort of leverage on networks that we had established in the past around other vaccines and with investigators from Oxford University as an example, as well as with industry partners, where they were able to partner and they were willing to partner with us. So where did we come short? Like I said, we didn't have vaccines that were being produced locally on the African continent. And unfortunately, to some extent, that compromised other scientists from being equally involved when it comes to how these COVID-19 vaccines work on the African continent. An important learning lesson was that had we not done the studies on the African continent, we wouldn't have been able to make informed decisions as to how to use these vaccines on the African continent, where the epidemiology did differ compared to in high-income countries. As an example, where a large percentage of the population developing infection-induced immunity even before the vaccines became available to the people on the continent.
Thank you so much for highlighting some of the key achievements of African countries in the pandemic, and it makes us proud as Africans to hear that. So we've been discussing some of the key challenges and opportunities that are present in the vaccinology space currently. But if you were to think about which ones you think are the most urgent priorities and the biggest opportunities for vaccinology in Africa going forward, what would they be, especially in areas of innovation, collaboration, and health equity?
Yeah, so I think it really speaks to the full pipeline of what is involved in vaccinology. So for me, I think where Africa needs to start standing up and focusing much more is in a space of research and development. I don't think we've got enough people in that space as yet, and that is required for us to start manufacturing vaccines and also to have that type of security which is required in the time of crisis. Like I said, we can't afford to go into another pandemic and not have vaccine manufacturing capacity available on the continent in multiple countries. And for that vaccine manufacturing capacity to develop, you have to do research and development. You have to have the basic scientists developing their own vaccines where they can take ownership and they're not sort of subject to the wants and fancies of other individuals as to whether they're going to share the IP rights to develop vaccines locally on the African continent. So I think much more investment needs to take place in that space. But then what's equally important is issues around implementation sites. Like I said, we can't continue where close to 1/5 of children on the African continent receive no vaccine. So the number of zero-dose children on the African continent is roughly about 20% of the birth cohort. And that is totally unacceptable. We've got life-saving vaccines. These vaccines are in country, yet these vaccines are not getting into the arms of children. And vaccines don't work unless they get into the arms of children. So we have to do the necessary community engagement. We need to figure out where it is that we're coming short in terms of ensuring that we get our vaccine coverage above 95%, which is achievable. Countries in Latin America that were in a very similar situation as where we are in the African continent 30 years ago, now boast vaccine coverage above 95%. And at that stage, they will probably have had similar sort of challenges that we're facing on the African continent in the year 2024. So it is achievable. But for us to achieve that, we need the scientists to work together with government, with the politicians, in partnership, with a common vision that what we're trying to achieve is we're trying to improve life, we're trying to save lives. And the only way we can do that is to ensure that we get vaccines into the arms of children.
Well, so it's sounding like you're saying we need more hands on deck to join this fight for vaccine equity and access. Thank you again, Dr. Madhi. And thank you to our viewers for tuning in. If you'd like to hear more of these insightful interviews, please like, comment, and subscribe below. And see you next time.